Understanding OCD. Hi everyone, and welcome. Today we're diving into obsessive-compulsive disorder, or OCD. It's one of the most misunderstood mental health conditions. Whether you're here out of curiosity, concern, or personal experience, this video will help clear up myths, explain symptoms, and talk about how OCD is treated and managed.
What is OCD? OCD is a mental health condition where someone experiences two main things: obsessions, which are intrusive, unwanted thoughts or images, and compulsions, which are repetitive behaviors done to ease the anxiety those thoughts cause. It's not about being quirky or overly clean, it's about being trapped in a cycle that can feel impossible to escape. Common obsessions. Obsessions vary from person to person, but common themes include fears of germs and contamination, harming others accidentally, doubts about whether doors are locked or stoves are off, or intense discomfort when things feel uneven or not right. These thoughts keep repeating, no matter how hard someone tries to ignore them.
Common compulsions. To calm these obsessions, people perform compulsions, like hand-washing, checking things, counting, repeating phrases, or arranging items in a specific way. For example, someone might wash their hands 20 times after touching a doorknob, not because they're obsessed with cleanliness, but because they fear they might get sick or make someone else sick.
OCD versus being neat. Let's clear this up. OCD is not the same as liking things organized or being a clean freak. Saying, "I'm so OCD," because you enjoy tidying up minimizes what people with real OCD go through. For them, these behaviors are driven by anxiety and fear, not choice or preference. Types of OCD. OCD can show up in many forms. Some focus on cleanliness or checking, but others deal with purely mental obsessions, like fears of committing sins, violent thoughts, or sexual intrusions. There's also just right OCD, where things have to feel perfect. Each type can be distressing, and some forms are invisible from the outside.
Intrusive thoughts. One of the most painful parts of OCD is intrusive thoughts, unwanted, often disturbing ideas that go against a person's values. For example, someone might have violent or taboo thoughts and feel horrified by them. These aren't fantasies or desires, they're symptoms. People with OCD are often the least likely to act on these thoughts.
What OCD feels like. OCD can feel like your brain is stuck on a loop. A thought pops in, anxiety spikes, and you feel like you have to do something, check, repeat, clean, to get relief. But the relief is short-lived. Soon, the obsession returns, and the cycle starts again. It can interfere with school, work, relationships, and everyday life.
Who gets OCD? OCD affects people of all ages, children, teens, adults, and all cultures and backgrounds. It usually starts in childhood or adolescence, but adults can develop it too. It's estimated that about 1 in 40 people live with OCD. It's more common than many people realize.
Causes of OCD. OCD isn't caused by one thing. It's believed to involve differences in brain function, particularly in areas that control decision-making and fear responses. Genetics can play a role. If someone in your family has OCD or another anxiety disorder, your risk may be higher. Life stress, trauma, or even infections in rare cases can also contribute.
OCD myths. Let's bust some myths. OCD isn't about being perfectionistic or clean. Not everyone with OCD washes their hands or organizes their closet. Some people never show physical rituals, because their compulsions happen silently, in their head. And no, people with OCD can't just stop by trying harder or calming down. Diagnosis. Getting a diagnosis is a huge step toward healing. A psychologist or psychiatrist will ask questions about your thoughts and behaviors, and how much they interfere with your life. OCD can sometimes be confused with anxiety, ADHD, or even autism, so professional evaluation is important.
Treatment options. Good news. OCD is treatable. The gold standard is a type of therapy called exposure and response prevention, or ERP. It helps you gradually face your fears without doing the compulsions. Medications like SSRIs can also help reduce symptoms. Recovery takes time, but it's possible, and worth it.
Living with OCD. People with OCD can absolutely live full and meaningful lives. Many find ways to manage their symptoms, build careers, raise families, and even use their experience to help others. OCD may be part of their journey, but it doesn't define who they are.
OCD can be cured. OCD is a real, serious condition, but it's also treatable, and you're not alone. If you think you or someone you care about might be struggling, reach out. Talk to a professional. Start the conversation. There's no shame in asking for help. In fact, it's a sign of strength.
Thanks for watching. If this video helped you understand OCD a little better, give it a like, share it with others, and don't forget to subscribe for more mental health content.